normalize the tight junction and stop the gut from being leaky. So the most well-recognized product is a butyrate, sodium butyrate, calcium butyrate, magnesium butyrate. So we designed a product called Leaky Gut 8, and so the PM version has calcium magnesium butyrate, and AM version has sodium butyrate. In addition, we add glutamine, and L-glutamine also restore the tight junction. All this have been published, so we just put different things in one combination. And acetylglucosamine and N-acetylcysteine, these are two common use products to normalize the abnormal gut permeability, and quite frequently we use them all in combination. So the next issue, which again we see quite frequently, is hypothyroidism and Hashimoto disease of thyroid gland. It's been described many years ago that up to 80% of people with a low thyroid function and Hashimoto disease, they carry HLA-DQ2 genotype, and this is directly linked between gluten and hypothyroidism. So again, if you're completely gluten-free and you still feel fatigued, you still feel like you have brittle hair, you have kind of lazy gut, you're prone to constipation, ask your physician to do a comprehensive workup for hypothyroidism and Hashimoto disease, because sometimes this condition can be subclinical, and administration of low-dose thyroid hormones can make a major difference. The next step is a group of conditions. It's pregnenolone deficiency, DHEA, and testosterone deficiency. We can group them in one because all these products are produced by our adrenal gland. So if you look at adrenal hormone production, all our adrenal hormones are produced from cholesterol. And the next step is production of pregnenolone. So for some unknown reasons, we don't know why, but pregnenolone production typically is suboptimal in patients who have gluten intolerance. And pregnenolone not only precursor for the adrenal hormones, but it also a key metabolite which keeps our brain awake. So when you have pregnenolone deficiency, you may experience fatigue and excessive somnolence during the daytime. So pregnenolone can be checked in the blood. The test is routinely available through most of the labs. The same is true for DHEA and DHEA deficiency. It's been described many years ago that DHEA deficiency is extremely common in patients with lupus and various autoimmune diseases, and we routinely check in patients who are suspicious for lupus and lupus-like diseases. Testosterone deficiency is extremely common in males. Extremely common, I would say, based on our estimate, 80 to 85% of males after the age of 40 who have gluten intolerance are testosterone deficient. And that's something which is very easy to fix because testosterone is available through injections and gels. Prolactin, so prolactin overproduction, not deficiency, but overproduction is very common, and it can cause headaches, chronic migraine headaches. And again, if we're dealing with a person who have chronic migraine headaches and gluten intolerance, we'll routinely check prolactin. And then a couple of more rare things, so polycystic ovaries. So very common, and polycystic ovaries, as most of you know, related to insulin resistance. So that's a very interesting topic because it brings up a completely different issue. So we're gluten intolerant, so we don't eat wheat. Are we missing something? And the answer is yes, we do miss one particular ingredient which is called inositol. So inositol comes from the wheat typically in our diet, and when we're wheat free, so we don't consume enough inositol, and it's inositol deficiency which can cause polycystic ovaries and insulin resistance. And if you substitute yourself with inositol, these things go away almost instantly. So, and this is a relatively new topic, which we start paying attention within the last maybe a few months. So it's diamine oxidase deficiency. So it's a very complicated topic. I'll try to make it a little bit kind of easy. So basically, our body makes histamine, right? And histamine is the main mediator of various allergic reactions. But at the same time, histamine opens up our blood vessels and it brings blood flow to the affected organ. So the histamine is degraded by the enzymes which called diamine oxidase. And so if you don't have, or if you're deficient in diamine oxidase, the histamine will persist in your body much longer, and it can cause various food allergies. So, and these are the people who suffer from horrible allergies. No matter what you eat, you develop a reaction. So in the 60s and 70s, it's been described that a lot of people who have Crohn's disease, colitis, as well as full-blown celiac disease, they have histamine oxidase or diamine oxidase deficiency. So the test was commercially available in the 60s and 70s, and somehow it became kind of forgotten. Now it's almost impossible to check the level of diamine oxidase in the blood. But if you start using histamine as a marker, and if you routinely measure histamine, you can pick up a subset of patients with gluten intolerance who have persistently elevated histamine. And by definition, these are the patients who have diamine oxidase deficiency, and these are the patients who should be treated. So what are the most common manifestations of the histamine oxidase deficiency? So it's constant itching, eczema, multiple allergies, upset stomach. No matter what you eat, you have a stomach pain. It's completely unrelated to gluten, completely. And chronic headaches. So how do we diagnose diamine oxidase deficiency? So blood diamine oxidase level is, this is the test which is available through some specialized labs, and right now it's quite expensive. Most of the insurances don't cover the test. Blood histamine level, on the other hand, is very inexpensive. It's covered by most of the insurances, and it's very reliable, and you can monitor this level prospectively. And then there's another product, it's called N-methylhistamine. So if you have diamine oxidase deficiency, your N-methylhistamine goes up as well. And so basically you can measure this metabolite easily. So if you feel like you fit to that kind of profile, then you need to be treated. So how do we treat it? So there's a diamine oxidase from porcine kidneys, which is available routinely right now. And it can be used as a food supplement, and it degrades histamine. So basically what you do is substitute whatever is deficient. And second, there's a whole group of products called bioflavonoids. The most famous one is quercetin, and bioflavonoids, they decrease the release of histamine from eosinophiles and mast cells. So basically we're using diamine oxidase and bioflavonoids in combination, and results are quite impressive. In addition, what you can do, if your symptoms are still poorly controlled with these supplements, you can try histamine-free diet. It's another tough diet, but sometimes it makes a huge difference. Again, there are a lot of information in this slide, but